Hello, happy Tuesday. Welcome to another anatomy lesson. Last week we discussed the sacrum and coccyx. If you haven't seen that lesson on YouTube video, go back and refresh your memory. I will be talking a little bit about the coccyx specifically today with this lesson with the pelvis and the hip. So go back and refresh so you'll know what I'm talking about. But welcome. Let's get started with our pelvis and our hip today. We're going to be learning the anatomy, the bones of the pelvis and the hip, as well as directions that your hip lets your legs go. Also, a little bit of x-rays to show you, a little bit of pathology, even a hip replacement, what that looks like, okay? Let's get started. Number one, the pelvis consists of several different parts. And I'm going to name them 1 through 10. Some of these are bilateral. If you go back to previous lessons, the one where we went over the terms, you can know what bilateral means. Bilateral means both sides, okay? Pelvis anatomy. The pelvis anatomy consists of wings or ala. Those are bilateral, one on each side, left and right. Bilateral iliac crest. Those are on both sides. Anterior superior iliac spines, bilateral, right and left. Anterior inferior iliac spine. So if you have a superior, you got to have an inferior, right? So the anterior superior iliac spine is also known as the ASIS abbreviation. So therefore, the anterior inferior iliac spine will be the AIIS. Once again, sorry, AIIS. Anterior inferior iliac spine. They also have ischial spines, superior pubic ramus, bilateral. If we have superior of something, we normally will have an inferior, right? So superior pelvic ramus, inferior pubic ramus, bilateral. A pubic arch, a symphysis pubis, and bilateral obturator foramen. Obturator foramen, we've learned these past few weeks, foramen is a hole. It's where blood vessels, ligaments and tendons, blood vessels and nerves go through those foramen. So obturator foramen is the biggest foramen in the body. Okay, the obturator foramen. The pelvis and the hip can be divided into and viewed into two parts. Anterior in the front, posterior in the back. The anterior part is called the pelvic girdle, which is composed of the pelvis, the pubis, the ilium, ischium. It connects the posterior to the spine, sacrum, coccyx, okay? The pelvis contains the bladder, the rectum, and part of the descending colon. In females, it also houses the uterus, fallopian tubes, and the ovaries. The main organs at risk for complications or injury are the rectosigmoid, the small bowel, and the bladder. So if you have a pelvic fracture, you could be at risk for injuries to the rectosigmoid, the rectum, and the sigmoid. We haven't gone over the colon yet. We will at a future lesson. But rectosigmoid, small bowel, and bladder are at the most risk for injury in a pelvic fracture. The bladder can rupture, can be caused by pelvic fractures, like I just said. That's most common. Male versus female, there's differences, okay? There are differences between the male and the female pelvis. And we're going to be going over those differences in just a second. But I wanted to get through the lesson first, and then we're going to go on to the anatomy with all the illustrations. One, we'll start out with the male. There's several differences between the male and the female. Male, the bones in the pelvis are heavier and thicker. There is a deeper false pelvis, okay? The cavity is narrow and deep. The pelvis in the inlet-outlet, the pelvis is heart-shaped and smaller. The pubic angle is more acute. Coccyx, once again, is less flexible, more curved. We'll see that in just a second. The ischial tuberosities are longer and they face more medial. Lateral, medial. Okay? That's what the male pelvis has. Female, let's see how they're different. The bones are lighter and thinner. So going back to the male, their bones in the pelvis are heavier and thicker. Female, bones are lighter and thinner. How about the false pelvis? False pelvis in the male is deep, while the false pelvis in the female is shallow. Shallow. Pelvic cavity is narrow and deep in the male. It is in the female. It is shallow and wide. Shallow and wide in the female. In the pelvic inlet, in the male, we said it was heart-shaped. Heart-shaped. In the female, the inlet is round or oval. The pelvic outlet in the male is small. The pelvic outlet in the female is large. The subpubic angle in the male is small. The subpubic angle is large in the female. Let me repeat that. The subpubic angle is more acute in the male, but in the female, it's large. Coccyx in the male is less flexible and more curved, but in the female, it's more flexible and straight, more straight, the coccyx. Ischial tuberosities in the male, longer, and they face more medial toward the inside. Opposite on the female. Female ischial tuberosities are more everted and they face laterally. So why is the inlet important in the female? Because that is where the birth canal is. That's where the birth canal is. The inlet in the pelvis. So, let's look at some pictures, some illustrations. I'm going to go through one at a time. We talked about the iliac crest. We talked about the ASIS. We talked about the obturator foramen, ischial tuberosity, symphysis pubis, or pubic symphysis. So let's see exactly where they are, okay? So here is our pelvis, That's the sacrum again from last week, and the coccyx is down here. Here you go. You have your ala or your wing. You have your ASIS. This is your iliac crest up here. That's what as x-ray techs use, MR techs, CT techs use to palpitate where your iliac crest is so that we can position you properly for any exam that you're having near the pelvis or the hip. Okay? Obturator foramen. Here's that big hole. Obturator foramen. Ischial tuberosities are here. Bilateral. Foramen. Bilateral. Iliac wings. Bilateral. ASIS. Bilateral. Inferior superior iliac spine. The AIIS. Bilateral. Here and over here. We're going to discuss the femur, the hip in just a second. So I will wait for just a minute before we go on to that part. But now you know where the ala, the wing of the iliac bone lives. Iliac crest, anterior superior iliac spine, ASIS. Also the obturator foramen, the inferior iliac spine. You know where those live now. And let's go on to the hip. I'm going to show you the picture, and we're going to be discussing what we're seeing. Let me go on here. This is the femur. To be exact, I'm showing you a picture of the left hip, the left femur. This is the top of the femur. The femur goes all the way down to your knee. All the way down to your knee. Okay, it joins your lower leg. This is the femur. Okay, there's your obturator foramen again. There is your ischial tuberosity again. This little line you see like a half C, that's the hip socket, also called the acetabulum. Acetabulum. Femoral head, femur, head of the femur, neck of the femur, greater tuberosity, lesser tuberosity, and this would be the shaft of your femur. In this case, the shaft of your left femur. So, left hip, this will be your left hip, your left femoral femur head, the neck of the left femur, greater tuberosity of your left femur, lesser tuberosity of your left femur, your shaft. It goes down, like I said, all the way down to your knee. This is the hip, anatomy of the hip. This is the left. You have the same thing on the other side, on the right side, okay? And to show you that, here is another picture. This is the femur, the head of the femur removed. This is the acetabulum. This is like the socket, the hip socket. So this goes right in here, right in there. This is the neck, greater tuberosity, lesser tuberosity, going on down to your knee. Once again, obturator foramen, ischial tuberosity, right there. This is a hip. We're just taking it and just move the hip, the head of the femur out of the way so that you can see where the acetabulum is, okay? There's some ligaments and tendons, but for this lesson tonight, we're just going to be going over primarily the bone. So we will save the ligaments and all that for another discussion. But now you know where the acetabulum is. You know where what the head of the femur is, the neck of the femur, the greater trochanter, lesser trochanter, going on down. Okay? Now, let's go on and show you what I've already told you about the differences between the female pelvis and the male pelvis. Like I said, the male pelvis bones are heavier, thicker, False pelvis is deep. Cavity is narrow and deep. The inlet's heart-shaped and smaller. Pelvic outlet comparatively small. Subpubic angle more acute. Coccyx less flexible, more curved. Ischial tuberosities are longer and they face more medial. Here is what the male pelvis looks like. Heart-shaped. The tuberosities go medial. Inlet, outlet, all of that. That's what a male pelvis looks like compared to the female. See, she's a little more round. The coccyx, if you can see that, can appreciate that, it's more flexible. It's straight. This one is not. That one is not. It's kind of curved, right? The coccyx is more flexible and more curved on the male than it is the female, okay? That's what a male versus female pelvis looks like. And just a regular picture of a pelvis doesn't have all the bells and whistles on it, but it has the sacrum, the coccyx, the symphysis pubis, iliac bone, SI joints. We talked about those last week. SI joints, sacral, iliac joint, sacrum, iliac, joint in between on bilateral, sacral, iliac joint of the left. This would be the right because it's backwards. That would be the left. Iliac sacrum, sacrum iliac joints right there. Symphysis pubis right there. Obturator foramen, ischial tuberosities. Okay? That's what just the plain pelvis. It's not really meant to be a male or a female. It's just showing you some of the anatomy. I do have a picture of a real live, true male pelvis right here. This is what a male pelvis looks like. You can see the foramen in the sacrum. Obturator foramens in the pelvis. Symphysis pubis is right in the middle. Right there. Obturator foramen once again. Bilateral ischial tuberosities. Your iliac crest. Your ASIS. Your inferior superior iliac spines bilateral. Your coccyx is here. Sacrum is here. That's a picture of a literal male bone, pelvis bone. It's what it looks like. We're going on to the next illustration. I want to show you a picture of a fractured hip. Like I said last week, week before that maybe, fracture and break broken are interchangeable. I've heard people say that it's not broken, it's just fractured. It's the same thing. If something is broken, it's fractured. If something is fractured, it's broken. Whether it be a hairline all the way through, and there's different kinds and types of fractures. We may go over those if you guys are interested. But if it's fractured, it's broken. It's broken, it's fractured. Okay? So I want to show you a picture of an x-ray of a right hip that is fractured. A right hip fracture can be from fall, car accident, anything trauma related. A lot of elderly people fall. whether they fall because their femur breaks, or it breaks because they fell. I'll say that again. You can fall and fracture your hip or any bone, but for tonight's lesson, you can fall and break your hip, or your hip can break on its own and cause you to fall. Okay? Either way, as we get older, our bones become softer, osteoporosis, easier to break, to be broken. Okay, whether it's just turn our leg wrong or whatever, our hips can break. Or any bone can break with your bones being soft. But this is a right X-ray of a right hip. Once again, here's the head of the femur. The neck of the femur is fractured. Greater tuberosity, lesser tuberosity, obturator foramen, just a little bit of it right there, a little bit of the ischial tuberosity and the obturator foramen there. Head is broken from the neck. The neck is broken. The head is here. Acetabulum, the hip joint, the socket is up there. Fractured right hip, right femur, femoral head, femoral neck area. What can they do? What can they do for that? You just don't want to leave it and let it grow, let it heal that way, correct? They can do what's called a hip replacement. This is a picture actually of a left. It doesn't matter. It'll be the same thing on the right. Okay? This is a hip replacement. They take all of that out. Take out the head of the femur, neck of the femur, all of that, and they insert a rod with a ball and joint, a ball, because your hips are a ball and ball and socket joint. So that they give them an artificial head, artificial neck, and they go down a little ways into the femur, greater trochanter, lesser trochanter, nail that in there, just like that. That is a left hip replacement. Left hip replacement. I'm going to show you some arthritis. Arthritis, as we know, is inflammation in a joint. Arthro, joint. Itis, inflammation, infection sometimes. So, let me show you severe arthritis versus advanced hip arthritis. Severe is going to be on the right. All of this up here, femoral head area, hip joint area. Severe hip arthritis. Well, how about advanced? Let's see what advanced looks like. You can tell the difference. The hip, the severe, in this photograph, in this x-ray, is more advanced than the other side, the left side. Advanced hip, so you can still see the head of the femur, the neck of the femur, greater trochanter, lesser trochanter going down the femur. This side is a little bit worse. You really can't appreciate where the head of the femur and the neck of the femur are, because where they start and stop, It's a little bit more arthritic, especially in the joint itself, especially in the joint. Now, we talked a little bit about the inlet and the outlet a few minutes ago, but I just wanted to show you the difference between the inlet and outlet so you would know, okay? So this is round. This is round. This is kind of an oval teardrop shape. That's the outlet. Here's the inlet. Here's the inlet right there. It's more round. It's anterior, okay? The inlet is anterior while the outlet is more posterior. Posterior. So you have your symphysis pubis is here, but on there, it's down. Okay, posterior. Okay, so I hope you've learned a few things about the pelvis and the hip tonight. Please continue to follow me. Next week, we're going to be going over, I think I'm going to start the femur, the long bones of the femur, the long bones, femur. We'll go on to the knee, and we'll go on to the lower leg, the tib fib, in about a week or two. So we're going to continue on down the lower leg. So we've started the hip today. That's where the leg starts, obviously. We'll continue on till we get down to the feet. Then we're going to move back up to the arms, the shoulder, the arm, upper arm, elbow, forearm, hand, wrist, fingers. Okay, stay tuned. Thanks again for watching, and I will see you next time. Bye-bye.